Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Jigawa state government conducts screening exercise in the state as it gives a picture of its COVID-19 fight so far. More protection for adult health workers as state government makes personal protective equipment available. And South Africa rolls out an initial 80,000 doses of Johnson & Johnson vaccine. And as the total number of confirmed COVID-19 cases in Nigeria nears the 150,000 mark, the message from the Nigeria Center for Disease Control, NCDC, is to mask on and take responsibility. According to the center, COVID-19 can affect anybody and is not a death sentence. 1,572 cases were reported last night from 28 states and the FCT, with Anambra leading with the highest cases at 344, beating Lagos 204 cases. However, in a supplementary update for the 16th of February from the center, the 204 new confirmed cases for Lagos were not included in Monday's report of 574 total cases confirmed. Other cases which recorded over 100 cases of the new cases last night include Oyo State, the FCT, Benue, while states like Rivers, Ogun, Ondo, Ebonyi, Kaduna recorded over 50 cases. The states with cases lower than 50 include Plateau, Kwara, Enugu, Akwa Ibom, amongst 19 other states. While 124,923 persons have been successfully treated and discharged, the death toll stands at 1,779, with 18 new deaths as a result of COVID-19 related complications. The country has witnessed relative reductions in infections in previous days, but according to the agency, states continue to be largely in charge of the coronavirus management and response, while the NCDC supports and receives daily reports from them. Meanwhile, global coronavirus figures stand at over 109 million cases, with the US, India, Brazil in first, second and third place, and followed behind is the United Kingdom and Russia in fifth place. In Jigawa State, about 6,141 suspected cases of COVID-19 have been screened, with 486 people testing positive. According to the governor of the state, Badaru Abubakar, 13 fatalities have been recorded, including a medical doctor, since the outbreak of the virus in the state. The governor gave the breakdown in a press briefing at the State House in Dutse, the capital, where he also says the number of suspected cases screened include over 1,000 Almajere that were repatriated from 5 states.
Training of over 2,000 health workers on infection prevention control and case management. Provision of 12 ambulances to support COVID-19 operations. Procurement of drugs, consumables, and all IPC commodities. Screening of 2015 NYSC COP 2020 NYSC COP members before entry into the camp. Summary of cases as at 12/2/21. Total number of patients screened 6,141. Total number found positive 486, total discharges 425, total mortality 13, including 1 medical doctor. Number of active cases on admission today is 48, including those on home management. Number of testing sites 29, number of treatment sites 4, the total number of health workers trained 2,344.
With the rising number of confirmed COVID-19 cases in the country, the University of Calabar COVID-19 task force team is scaling up its sensitization among students on the importance of wearing masks as the school begins its academic activities for the year. Speaking after the exercise, the chairman of the task force, Dr. Kingsley Akaba, explains that some of the students are finding it very difficult to comply, hence the Enlightenment program, encouraging them to obey the NCDC guidelines to curb the pandemic. According to him, the school management is putting more measures in place, such as the installation of automatic body sanitizing tunnels, free distribution of masks donated by corporate bodies, and the Cross River State government.
We discovered that as the students resumes, some of them are finding it difficult to comply. So we're trying to do an enlightenment program in terms of encouraging them to comply to the NCDC guidelines so that we'll be able to curb the cases of COVID-19, if possible to have a zero case of COVID-19. So we expect them to comply because this is a form of enlightenment and educating them about the need to comply so that to prevent them from getting this infection and to be their brother's keeper from transmitting this infection to their fellow students. If you notice also by the entrance of the gate, there's also a tunnel. In each entry point of the university, we have a sanitizer tunnel, which ensures that all students passing through the pedestrian will pass through there and they will be sanitized.
Over to Edo State, where the state government says it is making moves to prevent the rising rate of infection among its health workers by procuring additional personal protective equipment, PPEs. The state government also confirmed that it is ensuring strict compliance to the COVID-19 preventive protocols across all educational institutions in the state. The permanent secretary in the state's Ministry of Health was speaking during the state COVID-19 daily briefing.
The state government has been actively engaging in procuring additional facilities, particularly consumables, to ensure that patients who get confirmed for COVID-19 are adequately taken care of. And the schools that have been opened have enough equipment, including thermometers, to ensure that the temperature of the persons or the students who come to the school are duly taken every day to minimize anybody who may probably have COVID-19 or fever get screened enough to be isolated from the crowd to minimize the risk of them infecting others who are not positive. Also, the enforcement team have been actively working. Our mobile courts are very functional, and they are doing the needful to ensure that those who are found guilty of breaking the protocol of preventing COVID-19 spread are duly handled to minimize further spread of the disease.
We are a year into this pandemic, and masks have become a polarized issue. Some Nigerians wear masks, but some do not. Well, let's take a look at some of the reasons for double masking. Professor of Otorhinolaryngology, Titus Ibekwe, an ENT and public health expert, joins us virtually. Thank you for joining us on the program. Let's begin. And this is by really asking your take on double masking and if it slows the spread of the virus.
Thank you very much, Millicent. Just recently the CDC released a study which was led by Brooke et al. On her behalf. But the primary focus really of that research work is meant to be on fitness of face mask, how fit is made to be around the face, and how this is going to help in reducing the transmission of the disease. Vis-a-vis, double masking happens to be one of those ways of making this mask to fit the face accurately, so that the chances of leakages when you're wearing your mask will be very much reduced. It was noted that when you use double mask, that the second mask on top of the very first one is going to apply some good pressure, leading to good fitting, popping around the face, so that the sides and the edges, there won't be leakages, because these leakages will be tantamount to not wearing mask on this one. But beyond this, it's also noted that there are some other ways of also making this mask to fit in well without necessarily wearing double mask, because it's not everybody that will be very comfortable wearing two, because it's going to make breathing a little bit more difficult. And, So if you tie the edges of the the elastic that fits into the ear, if you knot it at the edges, so that at the point where it is directly attached to the face mask, it is knotted there, and then you push the redundant part inwards. This is also going to achieve the same thing that literally you achieve by using double masking, right? Same goes for even cloth mask. So when this is done, the chances that the exhaled air or breathing is going to leak will be reduced. That means that the membrane that is formed by the mask itself will practically trap every breath of us and, held back the particles that is coming from breathing and protect the environment so that source contamination will be reduced.
So Professor, would you advocate the NCDC, for example, the Ministry of Health, that we wear double masks and, also for health workers, because we know they wear these surgical masks, the N95. It is said that a cloth mask over the surgical mask protects, the aerosols, protects from the aerosols from getting in. So would you advocate that?
Yeah, the N95 is perfect. But of course, we know that it's not everybody that can afford the N95. It's pretty expensive because the N95 will give you the perfect fitting that you need, in which case there is no need. You're trying to put another mask on top of it. If you choose to use the N95 mask, this is a typical sample of that. You can see it forms a very good cup. But we know that this goes for approximately 2,000 naira. And anybody that is using this is disposable. You use and discard. So it's a lot of expenses. But of course, the medical mask that you mentioned, which is this, when you knot the edges, as I have said, you tie these edges, right? And you're using that, it gives you the fitting that you need. Same goes with the cloth masking, which of course is reusable. We can recycle this and wash, dry up, and is ready to use again. So the most important thing is the fitness of this mask, rather than even double masking, to ensure that the edges do not have redundant edges through which unfiltered air can go out. Once it fits in very well into the face and forms a good box, it's good to go.
Another question is, Professor, when exercising outdoors, is it advisable to use the masks?
Exactly. When you are outdoors, it's very important to use the mask. If you are indoors alone, there's no need using this because you're just alone there. When you are out there, the chances that you will contaminate others or you get contaminated is very high. But that you even contaminate the environment itself is very high. So the mask should be used, especially when we're outdoors, to ensure that this filtration is maintained and we're able to protect ourselves and protect people around us. So whether you are using the N95, you're using the medical mask, or you're using the cloth mask, the important thing is make sure that it's well fitted so that the chances that you breathe in unfiltered air around you is not there. And again, physical distancing is going to increase the chances of reducing the chances of our getting infected. And of course, finally, washing regularly our hands and ensuring that there is good respiratory hygiene.
Professor, in terms of the messaging of the non-pharmaceutical protocols, are we not over-relying on the use of a face mask when other things like, some would argue, access to paid sick leave when you develop COVID-like symptoms, isolating yourself, rapid testing and results, vaccination with urgency? I mean, don't these other measures offer greater benefits in preventing the spread of COVID-19?
Yeah, Vincent, we are talking of feasibility here. These three I've mentioned, they are very cheap and very feasible. It costs nothing to do them. When you talk of make sure that your mask is intact, make sure that you maintain physical distancing, and that you wash regularly. These are very cheap things that can be easily achieved, rather than talking of isolating and leaving entire work that you should do. And of course, we know that the vaccine is not easy to come by either. Everybody is praying that it's here that will get it. But of course, even the developed world is struggling to make sure that their populace have this. But the cheapest and the easiest means of protecting ourselves lies on these three. And that's why a lot of emphasis has been on them to ensure that we mask regularly, physical distancing, and to cleanse, to cleanse our hands and maintain good respiratory hygiene.
All right. We appreciate your time on the program, Professor Titus Ibiakwe. Thank you for joining us.
It's a pleasure. Thank you very much.
Still ahead, the global report on the SARS-CoV-2 virus. Do stay with us. Welcome back. South Africa has begun the much-anticipated rollout of the COVID-19 vaccine using the Johnson & Johnson option. President Cyril Ramaphosa was among the first batch of people to be vaccinated. The single-dose vaccine is part of an implementation study by the South African Medical Research Council and the Department of Health. Our South Africa Bureau Chief Betty Dibia reports.
After the AstraZeneca setback, the Johnson & Johnson vaccines arrived late on Tuesday from Brussels and were immediately distributed to 32 vaccination sites across the country. President Cyril Ramaphosa, who is attending a parliamentary debate in Cape Town, was almost the first to take a jab at the Khayelitsha District Hospital.
And I was rather pleased that there were 5 people who were vaccinated before me, and they are health workers, and it was a joy to watch them to see whether anything had happened to them, and gladly nothing had happened to them. And it means that being vaccinated is a fairly straightforward process. And I'd like to invite South Africans to take this up so that we can all be safe, we can all be healthy. And I'd like to say to all the doomsayers who've been, preaching that there's going to be total mayhem and disaster, I think let's all have hope and faith in our system, in our health workers, and let's give them an opportunity to do what they do best, because they know how these vaccination processes are going to unfold.
Health Minister Dr. Zweli Mkhize, who also got vaccinated in Cape Town, commended health workers, whom he said have been going through a grueling battle. He outlined what is being done and what will be coming afterwards.
We have today distributed throughout the whole country 80,000 doses of our vaccine, and this 80,000 is spread to over 32 sites throughout the country, and those sites are largely the sites which are Medical Research Council sites combined with those of the Health Department who are managing the rest of the program. We're expecting between now and the end of about 4 weeks, we should at least be able to reach about 500,000 doses that we should be able to receive. And in that process, they will be coming in waves, and week by week, we should be getting additional doses. And out of that process, we will actually be vaccinating at the same time running an implementation study.
South Africa's goal is to vaccinate at least 40 million people in the country, which make up about 67% of the population, to attain a measure of herd immunity.
Our South Africa Bureau Chief Betty Dibia joins us right now. Hello, Betty. At last, the vaccine rollout begins, and we see the president taking the jab in that report. What's the prevailing sentiment about the vaccine?
For those who have taken, they were nervous and then they're hopeful. Generally, I guess it's renewed hope, especially after the setback we recorded a week or two ago regarding the AstraZeneca. But people are watching to see if, and hoping that this will work out, and just to get a move on. They're happy that a measure of progress has taken place, and the vaccine rollout is not only in Cape Town, but it began in Cape Town. It's happened across the 9 provinces of the country, and they're hoping to go on as more of the batches of the vaccines come in, because they're not stopping with 80,000 doses that have come in already.
Has it been confirmed how effective the Johnson & Johnson vaccine is against the B.1.351 or the dominant South African strain?
Well, the from the scientists, the figures that we got is that for the pre-existing variant that you just mentioned, the overall efficacy is 66%. 85% for severe illness and 100% against death. But for the 501YV2, that's the new variant, it has about 57% overall efficacy, 85% severe illness, and then 100% against death. So they're hopeful, but this rollout, this part of the rollout is as the minister said, part of what they call the implementation, their monitoring implementation study, like an extension of the study on that vaccine, which began much earlier in the Americas. South Africa contributed about 7,000 participants in that study. So now, working with the health workers or administering it on the health workers who come face to face with those who have contracted the virus on a daily basis, they're measuring or monitoring the real life effectiveness of the vaccine. So it's going to continue like that as they go on. But they're not stopping with the Johnson & Johnson. Negotiations are still on, and they're hoping to bring in others like the Pfizer vaccine as well.
Yeah, because I was going to ask if, you expect it will be the 67% for herd immunity, if it will be Johnson & Johnson all the way. But do you think that hospitals are ready to receive them? We understand that some sites have been identified and the vaccines are to be distributed equally.
Some provinces are bigger than others, and the need, like an area, Gauteng province, where you have Johannesburg and Pretoria, is a small province in land size, but the population is much higher. And then you have a place like Eastern Cape, which is quite huge, but the population is not as high. So they're trying to distribute it equitably and to make sure that where it's needed, it gets to everyone. But as I said, they're not stopping with the Johnson & Johnson. They booked about 9 million doses, and for the Pfizer is 7 million, but they will be coming 200 this time. By June, they expect March, from March, the first batch of the Pfizer will be coming in. By June, they expect more, 7 million doses from Pfizer, and other negotiations are still on. But the hospitals, you have those who had already been trained for the AstraZeneca, but they've had to, the Johnson & Johnson is a single dose vaccine. The other is not, like the Pfizer is not a single dose of vaccine. So they're having to retrain and continue training the health workers who will be administering. And the healthcare centers have already been prepared all along. Remember, we had the hard lockdown from March last year to prepare the hospitals to deal with situations. And trainings and the studies and the research, the trials are still going on in the country, because as it's moving, they want to keep moving along to be able to deal with whatever situation.
All right, many thanks. Our South Africa Bureau Chief, Betty Dibia. Always a pleasure.
Thank you very much, Millicent.
British Prime Minister Boris Johnson says that it's absolutely right to take a data and not dates approach to easing the country's COVID-19 restrictions, as England will ease the measures cautiously. The country has begun the world's first trial of the use of 2 different doses of COVID-19 vaccines. Mr. Johnson based his response to the issue of lockdowns on the experience last year when hospitality was fully opened last, because there is an extra risk of transmission from hospitality. Well, continue to take responsibility is still the message. Visit our website, channelstv.com, for more updates, a better understanding of the pandemic. Plus, you also find several other stories in politics, news, business, and sports, all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.